Assalamu alaikum students. Today our practical is about renal function test.
So what's the objective of today's practical or the learning outcome of today's practical? At the end of the practical you should be able to tell me what are the tests done in renal function test, what are the causes of renal failure, what is the normal range of serum urea, serum creatinine and uric acid, what are the causes of high and low urea, high and low creatinine and high and low uric acid, and to be able to calculate the blood result when we give you the absorbance of any test. So what is renal function test? Renal function test is a group of tests done to check the function of kidney so that we can diagnose kidney disease and we can follow up on patients who already have kidney disease. What are these renal function tests? Serum urea, serum creatinine, serum uric acid, plasma protein, and serum electrolytes and pH. Urea, creatinine and uric acid I'll be discussing with you today. Plasma protein we have already done it, and regarding the last one, serum electrolytes, you will do it inshallah next year. So before we start doing renal function test and understanding the results, we should know what is renal function or what is the function of kidney. Function of kidney is to excrete waste from the body. This function can be broken down into 3 steps. First step, blood containing the waste material reaches the kidney. How does it occur? Through renal artery. Second step, the functional unit of kidney, nephron, will filter the waste. What does filtering the waste mean? All the waste compounds like urea, creatinine are concentrated in the nephron, while all of the good stuff like sodium, potassium, water is reabsorbed back into the blood. What's the last step? After the third step, after the waste is concentrated in the nephron, it is excreted to outside of the body via a tract. What is this tract? Ureter, urinary bladder, urethra. This slide is same as the last slide. The 3 steps of the function of kidney. First step, blood containing waste reaches kidney via renal artery. Second step, nephron does the filtration. Third step, after the wastes are concentrated, they are excreted through the outflow tract, which is ureter, urinary bladder and urethra. So as the function of kidney is done in 3 steps, if any of these steps is impaired or if any of these steps is unable to function, the whole kidney function will be affected. This will lead to a state called renal failure. Now, renal failure we can divide into 3 types, the causes of renal failure into 3 types according to which step of the renal function is impaired. If the first step is impaired, it's called pre-renal failure. If second step is impaired, it's called renal cause of renal failure, and if third step is impaired, it's called post-renal failure. We will discuss the causes of renal failure. The first cause of renal failure is pre-renal causes. In pre-renal causes, we have all the conditions which cause less blood to reach the kidney. What will cause less blood to reach the kidney? Congestive heart failure. What is congestive heart failure? The pumping mechanism of the heart is not strong enough, it's not efficient to deliver blood to all parts of the body. Low blood pressure. When the blood pressure is less blood reaches different parts of the body. Fluid depletion or dehydration. If a person has dehydration, he has less blood volume. If he has less blood volume, less blood will reach kidney. Renal artery stenosis. The renal artery is narrow. This will lead to less blood reaching the kidney. All these causes will cause renal failure, and these all causes are called pre-renal failure. Second cause, renal cause of renal failure. What does the kidney do in its function? It does filtration and concentration. Which part of the kidney does filtration and concentration? The glomerulus and the nephron. if any disease affects them, it will lead to low functioning and renal failure. So what are the diseases which can affect them? Glomerulonephritis and acute tubular necrosis. Third cause of renal failure, post-renal failure. Post-renal failure means any disease which affects the urinary tract or the outflow tract. What is this tract called? Ureter, urinary bladder and urethra. If there is any physical obstruction of ureter or the bladder or the urethra, urine will not be excreted and then the renal function will be affected. What can cause obstruction? Stone can cause obstruction. Stone in ureter, stone in bladder, stone in urethra. What else can cause obstruction? Tumor. Tumor can be benign or malignant. Any tumor in urethra, any tumor in bladder. What else can cause obstruction? Prostate. If prostate is enlarged, it will compress the urethra, leading to obstruction of urethra. All this cause post-renal failure. How to remember these causes easily? Pre-renal failure. Pre means before. Renal kidney. What is before the kidney? It's the renal artery or the blood supply to the kidney. So anything affecting blood supply is pre-renal. Renal cause of renal failure. What's in the kidney? What's the functional unit? Glomerulus and nephron. Any disease of glomerulus and nephron will cause renal cause of renal failure. Post-renal. Post means after. What's after the kidney? Ureter, then bladder, then urethra. Anything which affects flow in the urethra, anything which affects flow in the ureter, bladder or urethra will cause post-renal failure. Just to help us remember the renal causes, I like to compare renal failure causes with the garden watering system. If today I go to my garden and I turn on the water and there is less water coming or no water coming, it means there is some problem. This problem or defect can be in 3 different places. First place, pre-tap. Pre-tap means the problem is in the tank which has the water or the connection between the tank and the tap. Other problem can be in the tap. Tap cannot be turned on. Third problem can be in the hose. Hose has some obstruction. There is something stuck in the hose, so water is not coming out. Just like this garden watering system, we have pre-renal, renal and post-renal. So we had 5 objectives today. We did the first one. What is this group of renal function tests and which test does it include? We did the second one, the causes of renal failure. Now we will come to our third objective, which is the normal range of urea, normal range of creatinine and normal range of uric acid. Before we tell you the normal range of urea, it's nice to know some background on urea. What is urea? Urea is end product of catabolism of amino acid. Where does this take place? It takes place in liver. So urea is produced in liver during urea cycle. What is urea? Is it something good? No, it is a waste product which should be removed from the body. What is the normal range of serum urea? 20 to 40 milligram per deciliter. Some places they use another unit, millimole per liter. If you have to convert to millimole per liter, you remember this equation. 1 millimole per liter of urea is 6 milligram per deciliter of urea. So if I have results given in millimole per liter, if I want to convert to milligram per deciliter, I'll multiply by 6. If I have the result in milligram per deciliter, I want to convert to millimole, I'll divide by 6. Let's start with causes of high serum urea. The first cause of high serum urea is renal failure. And then what are the causes of renal failure? They are divided into 3 types: pre-renal causes, renal causes and post-renal causes. What are the pre-renal causes? You should write here congestive heart failure, low blood pressure, fluid depletion, renal artery stenosis. What about the renal causes? What are the renal causes? Glomerulonephritis, acute tubular necrosis. What about post-renal causes? These are obstruction in ureter, urinary bladder, or urethra. Second cause of high serum urea is increased production of urea. When does this occur? If we have increased protein in diet. If we eat increased protein in diet, there will be increased catabolism. Increased catabolism will lead to increased catabolism of protein will lead to increased urea production. Trauma or burn, because during trauma or burn, our muscle protein and skin protein are destroyed. These are then absorbed by the body and broken down to urea, leads to high urea. And the last cause is gastrointestinal hemorrhage. This means bleeding inside the digestive system, like inside the esophagus or stomach. Now let's discuss causes of decreased blood urea. In causes we have acquired and hereditary. In acquired we have liver disease. Why is it so? Because liver is responsible for urea cycle. If liver has a disease, it will not be able to do the function of urea cycle, so urea will decrease in blood. What else? Another cause, malnutrition. Malnutrition means the person's diet is deficient. So if person is not eating proteins at all, he will not have any catabolism of amino acid and no urea production. Other cause is hereditary. It is it's a cause which is one is born with. In this cause there is problem in the enzymes which are for urea cycle are deficient, or they are not working properly. Let's come to the second test of today, estimation of serum creatinine. Before I start the normal range, let's do what is serum creatinine. Before we discuss creatinine, let's come to our muscle metabolism. In our skeletal muscle, we have a compound called creatine. creatine. Creatine is found in the muscle. It helps us produce energy when we are exercising. Now, 1 to 2% of creatine of our muscle is broken down every day into creatinine. Creatine in our muscle is converted non-enzymatically and irreversibly into creatinine. Creatinine is a waste product. It is a nitrogenous compound which should be removed from the body. So the amount of creatinine produced in my body depends on how much muscle I have. Creatinine does not depend on the amount of protein in the diet. Now let's discuss the normal range of serum creatinine. The normal range is different in men, different in women, and different in children. In adult men, it's from 0.7 to 1.2 milligram per deciliter. Adult women, 0.5 to 1 milligram per deciliter. And in children, it is 0.3 to 0.6 milligram per deciliter. Why do you think the range is different for men, women, and children? Well, serum creatinine comes from the breakdown product of the muscle protein. So depending on the muscle mass, the serum creatinine is different. Men have more muscle mass than women, and then adults overall have more muscle mass than children. That's why the values are different. Now let's discuss the causes of high serum creatinine. The first cause is renal failure. In renal failure, you will write the causes of pre-renal failure, causes of renal failure, causes of post-renal failure. Then the second cause of high serum creatinine is rhabdomyolysis. This is the sudden breakdown of skeletal muscle due to some injury. What injury can cause sudden breakdown of skeletal muscle? This can be a trauma, car accident, or it can be electrical lightning, or it can be snake bite, bite by a poisonous snake. The third cause of high serum creatinine is certain drugs. Which drugs? Some drugs, they inhibit the secretion of creatinine into the nephron. These drugs are gentamicin and cimetidine. We have causes of low serum creatinine. This is rare and it's not significant because high serum creatinine is dangerous in the body. Low will not cause any problem. But what causes low? Muscle atrophy. If someone doesn't have skeletal muscle volume, he has muscle atrophy due to paralysis, then of course because he has low muscle volume, he will have low creatinine. Another cause is when a person has jaundice or high bilirubin. So the blood test, if we do for a person who has high bilirubin, the blood test will interfere. The yellow color of the bilirubin will interfere with the creatinine test and give low reading for creatinine. Let's come to the last test for today, estimation of serum uric acid. What is uric acid? Uric acid is the catabolic end product of purine metabolism. Again, it's a waste product which should be excreted. What are purines? Purines are nitrogenous bases, adenine, and nitrogenous base guanine. Where are these purines found, or where is adenine and guanine found? They are found in the DNA as adenosine triphosphate, guanosine triphosphate, ATP and GTP in the DNA. And where is DNA found? In the nucleus. So whenever we have excess breakdown of cell nucleus, we will have excess serum uric acid. The normal uric acid, in an adult male is 3.5 to 8 milligram per deciliter, and in an adult female is 2.5 to 6 milligram per deciliter. Now let's come to the causes of increased uric acid. These are little bit difficult, so please try to focus with me, and let's do it in a different way compared to the book. Let's divide the causes into decreased excretion and then increased production. In decreased excretion, we have normal uric acid, but unfortunately I am not removing from my body. If I am not removing from my body, it will start to increase in my blood. What is the disease in which I am not removing the waste from my body? First disease is renal failure. And then in renal failure you have causes of pre-renal failure, cause of renal failure, and post-renal failure. What other condition can cause decreased excretion? Some medicines like diuretics, they increase the reabsorption of uric acid from the kidney. So uric acid increases in the blood. So these were causes of increased uric acid in which the problem was decreased removal. Now we have other cause in which kidney is working fine, kidney is removing, but I am producing too much, I am producing excess. When can I produce excess? Whenever I said we are breaking too many cell nuclei. When can we break cell nuclei? We have condition called tumors, benign tumor or malignant tumor. For malignant tumor, they are called cancer, and we give chemotherapy. Chemotherapy are medicines which break the cancer cell. Each cell has nucleus. When I break the cancer cell, the nucleus is broken. If the nucleus is broken, ATP, GTP broken, leads to excess uric acid production. So any patient of cancer, when we give him chemotherapy, uric acid increases. Another cause is as excess alcohol consumption. There are many reasons why drinking excess alcohol increases uric acid. These all, the mechanism is postgraduate level, so we will not discuss. We will just remember excess alcohol consumption increases uric acid. Another cause is starvation. What happens in starvation is a person has no food to eat, no diet to eat. There is completely no food he is eating. So what does the body do for survival? The body will break its own muscle, its own bones just to get energy. So when we are breaking our own muscle, of course we are breaking the cell nuclei purines are broken, uric acid increases. Then there is another disease which is diseases that have high cell turnover. High cell turnover means diseases in which cells are made and then cells are broken. Cells are made, cells are broken. Which diseases are this? Leukemia. Leukemia is type of white blood cell cancer. White blood cells are made and then automatically broken. It will lead to increased uric acid. Another is psoriasis. Please look up psoriasis to find out more about it if you are interested. But just remember few facts. Psoriasis is a skin disease in which excess skin is made. And then the skin excess is made and then it breaks. So we make a cell and then we break the cell. When we break the cell, we break the nuclei, we break the DNA, we break ATP, GTP, so uric acid goes up. And then the last cause is inborn error of metabolism, Lesch-Nyhan syndrome. It's a syndrome in which the enzyme for the recycling of purines is deficient. The enzyme which is for recycling purines is deficient, so excess purines are broken, it leads to high uric acid. The word you must have heard often, gout. What is gout? Gout is whenever there is excess uric acid in the body. The excess uric acid can be because of any cause. We did the causes in the last slide, right? Whenever there is excess uric acid, it sometimes deposits in some joints of the body. When it deposits in the joint, it causes pain, too much pain and inflammation. This is called gouty arthritis. So gout is deposition of excess uric acid in joints of the body. Usually it occurs in big toe of the foot. So we did renal function test, serum urea, serum creatinine, serum uric acid. Now we said serum urea is affected by protein in the diet. If I eat too much protein, I'll have too much of urea produced. Uric acid is also affected by diet. How? If we eat too much meat has again too many cells and each cell has a nucleus, it can increase the serum uric acid. So serum uric acid also affected by diet. Serum urea affected by diet. Which test is affected by diet? It's serum creatinine. So it's the most reliable test of renal function test because it is not affected by diet. This slide is your homework. Please solve this slide on your practical notebook. Take a picture or scan it and email it to me at my email hajar@dmcg.edu. Your attendance will be marked according to the responses I get of this homework. And if any questions, please feel free, don't hesitate to email me at hajar@dmcg.edu.